There's this outfit called the National File. And the National File, which I was not really that much aware of, obtained a recording of a Zoom video conference between physicians and their marketing director.
Oh, boy.
At Novant Health New Hanover Regional Medical Center. This is a group of 20 hospitals, clinics, and offices that are treating patients in North Carolina, in South Carolina. So in this recording, you have Dr. Mary Ruddick, you have the director of marketing, Carolyn Fisher, and then you have another hospital employee. So just to set the tone here, this is from an internal source at Novant Health who recorded this week. The quality of this video is horrendous, but it's unavoidable that you have to hear this. This is senior doctors and a marketing director in North Carolina. They're treating North Carolina and South Carolina patients. So the first speaker you're going to see is the marketing director, and she seems to be answering a question about how COVID-19 patient counts are determined and then shared with you, the public. This is Novant Health Cut 10 from the beginning.
Dashboard and how it's set up myself as far as how we get information out to the community on meaningful numbers. We do that on a weekly basis. So that's on our website, and we've been sharing that through social channels as well, particularly those graphics that show the number of patients in-house, the percentage of them that are unvaccinated, the percentage of unvaccinated people in the ICU, and the percentage of deaths and the numbers. So those are numbers that we put out. As far as we don't get into details of floor or those other numbers are certainly out there.
Okay, so stop it for a second. So now who you're going to now hear from is Dr. Mary Ruddick, and she's in charge, I believe, of this whole facility, of these 20. She oversees this whole operation. Now, and I've taken the liberty here to actually type out what she says so you can read it precisely, as her director of marketing has just kind of told her how they come to the numbers that they're putting out. Here's what the doc's idea is. Roll it, G.
I guess my feeling at this point in time is maybe we need to be completely a little bit more scary for the public. Then there's another comment, is I completely agree. There are many people still hospitalized that we're considering post-COVID, but we're not counting in those numbers. So how do we include those post-COVID people in the numbers of the patients we have in the hospital?
So is that all the people who have been in the hospital since the beginning of COVID?
Well, or that are still in it, and that's something that I can take to someone else. But I think those are important numbers, the patients that are still in the hospital, that are off the COVID floor, but still are occupying the hospital for a variety of reasons.
Okay.
Carolyn, we call those, we're calling those recovered now. If you look at the Novant Health dashboard, they're listed as recovered. But I do think from our standpoint, we would still consider them a COVID patient because they're still healing.
Yeah. So I think that needs to be highlighted as well.
Yeah.
Because once they're off isolation, they drop from the COVID numbers. That's exactly right.
Carolyn, we can talk offline and how we run that up to marketing. And
right. So I'm just going to say, Carolyn, I think we have to be more blunt. We have to be more forceful. We have to say something coming out. You don't get vaccinated, you're going to die. I mean, let's just be really blunt to these people.
Well, there's the director of 20 hospital offices saying, we got to find a way to inflate the numbers, and we got to scare the hell out of everybody and tell them they're going to die.